February is Heart Health Month. It's a good time to learn the signs of heart disease, the steps we can take to protect ourselves and those we care about. I spoke with the team at Sinai Chicago to learn more.
At Sinai Chicago, the cardiology department, we are covering a complex array of cardiovascular spectrum, from heart disease like heart attacks, arrhythmias, heart failure. We also work on peripheral arterial disease. We have a comprehensive cardiovascular care. In the United States, we have over 600,000 people dying of heart attack every year. In Chicago, 20% of life lost are due to heart disease. So I think since February is a Heart Health Month, it's a good time to raise awareness about the impact of risk factors to prevent cardiovascular disease.
You can have symptoms and not even realize that you're having a heart attack. You could think you're having an upset stomach or even a cough that may make you think that it's not even heart-related. That could be. There's just a lot of different symptoms, especially when you differentiate women between men.
What are some of the causes of heart disease?
Depends on the risk factors, obviously. You can have family history, but we can have diabetes, high blood pressure, high cholesterol, smoking, stress, inactivity. This can all lead to increased risk factors for cardiovascular disease, and in time you can build up plaques and can cause heart attacks.
Blood pressure creeps up on you, and there's a lot of people that have hypertension and they don't realize it. It increases and you don't necessarily have symptoms. You want your blood pressure to run less than 130/80.
After a certain age, everybody should check with their primary care initially, their cholesterol, their diabetes numbers. Obesity is also very important to be under control. It's very important to check the blood pressure because knowing your number, you can prevent a complication of the blood pressure, which is called the silent killer. But in time, having high blood pressure, your arteries are, feeding the brain, the heart muscle, the organs, the kidneys, and they're gonna cause slow damage, and you end up with dialysis, strokes, and heart failure. If they say, okay, your blood pressure is mildly elevated, you can start by doing things to lower the blood pressure, which is change your diet, cut down the sodium, cut down the alcohol, stop smoking, exercise. All these are going to help decrease the blood pressure. Also, if you are overweight, losing weight is going to help. So there are ways to prevent and help before you go onto medication to decrease your high blood pressure. Here at Sinai, we have a lot of cardiologists that they can see the patients and try to work with the patients and with their doctors. At Sinai Chicago, we serve the west side and southwest side of Chicago, in which most of the population is Black and Latino, which are very well known to be more affected by diabetes, obesity, high blood pressure, alcohol abuse, and smoking also. So those are things that we can impact into these communities to reach out to them and get them to understand and know what's actually happening.
Why should Sinai Chicago be the choice for a lot of people, especially here on the south and southwest sides?
Our cardiologists are very involved in their patient care. We do a lot of different procedures like remove heart blockages, and we also monitor our patients very closely.
Grab those phones and scan the QR code on your screen for more information. You can also visit their site at sinaichicago.org to make an appointment today. Just give them a call.